Some physicians at Mercy Hospital in Chicago's Bronzeville neighborhood are speaking out about the proposed closure next year. The hospital says it is losing millions of dollars a month.
Advocates say if that happens, there will create a healthcare desert in that area. So joining us now to talk about it is Dr. John Kudecki. He's a physician at Mercy Hospital, and you're trying to save the hospital, aren't you, doctor?
Well, we are. I've been there for 27 years. That's pretty much my only practice out of residency, and we take care of a lot of patients there, a lot of people who are underserved. There's not a lot of hospitals left on the south side of Chicago, and we're really trying to keep it alive. I don't think that the current company that runs the hospital can do it. I think we need government help from the state or maybe the city or the federal government to keep it alive. It's just the company that's been managing it for all these years, for the last 10 years or so, is pretty much mismanaged it and lost a lot of money. But we feel like it could be a viable place, and there's an extreme need for a lot of underprivileged people who have their babies there, who have their surgery there, go to the emergency room there. And there's a lot of people of color and Asian people that really rely on the hospital, so we hate to see it go.
Well, doctor, this isn't the first protest that has happened, and it has been a call for the government to step in. The governor has said, well, we're talking with hospital officials and possibly the General Assembly. Does that give you hope?
I don't know. I mean, there was a proposed merger a few months ago that went kaput after COVID started, where 4 hospitals on the south side were going to merge and possibly build a new hospital. And that got voted down by the General Assembly. And it doesn't seem like the politicians really care about the people that vote for them, that keep them in office. I mean, this is a big deal for a lot of people. I have a lot of scared patients who, they're terrified. They don't know where they're going to go for their care. And a lot of them take the bus. They don't drive there. A lot of people just don't have the means to go a lot of other places.
You spoke a little bit about people of color and how this will hurt them. And, you know, statistics show that in these areas, these urban areas, there are not a lot of hospitals there. Maternal fetal mortality is, would be affected as well as far as people of color. What is your thought as far as the possibility of this being saved, of this actually keeping Mercy open?
Well, I don't think it's going to be having to do with Trinity Healthcare, who owns them. I think they've given up on the place. I think we're hoping to get a 1-year stopgap funding from some government agency for us to keep it open, possibly with a new owner, and then develop a plan for a more long-term plan to keep the hospital maybe a smaller size, maybe more outpatient, stuff that's more useful for the community. It's just, like I said, there's a lot of Asian people from Chinatown, a lot of Hispanic people, African Americans, you name it. It's like a melting pot there. And the people need help.
Well, it's so difficult when you look at dollars and cents, though. How do you determine that, though? You know, the state is having issues, this city is having issues, and then we've got a pandemic. They just say Absolutely. They don't have money.
Yeah, I mean, well, how could you close a hospital during a pandemic? That seems to me just immoral in a lot of ways. But I know money's short, but I mean, this is important for a lot of poor people that have no other means of getting health care.
Doctor, we talk about the people that you serve, but there are a lot of doctors and nurses and assistants that are there that could lose their jobs, right? You've been there 27 years. What would happen to you if Mercy closes?
No, absolutely. For me, it doesn't affect me so much because I'm not employed by the hospital. I'm in a private practice, but there are a lot of employed physicians that have labored over COVID. They've been at the front lines of COVID, saving people. There's a lot of this. I don't know. There's somewhere around 2,000 employees in the hospital, and that's something that is another consideration too.
Dr. John Kudecki at Mercy Hospital. Be safe, be well, and good luck to you.
Thank you very much for taking the time out.
Of course. Coming up, the